As COVID-19 cases surge again across much of the U.S., President Joe Biden made the Southern Africa travel ban decision. He called the move cautious, but did it on the advice of federal medical experts.
We don't know a lot about the variant except that it is a great concern. It seems to spread rapidly.
Michigan hospitals are so overwhelmed with COVID-19 patients, the federal government is sending doctors and nurses to the state to reinforce medical staff. The governor of Massachusetts has ordered hospitals running out of beds because of COVID-19 to cancel elective surgeries starting next week.
As a healthcare worker, really devastating to have to make people wait for so long to get care that they really do need.
Similar orders have been made in Maine and New York. At this Long Island hospital, the emergency room has been temporarily closed because there are too many patients and too few nurses.
With hardly any notice, this was thrust upon us in our community.
Erie County, New York just recorded its highest daily number of new COVID-19 cases ever. ICU beds are becoming scarce.
Unfortunately, we are going in the wrong direction, and this is the worst direction we've ever had.
The increase in cases and hospitalizations comes as doctors prepare for another COVID-19 surge following the busy Thanksgiving holiday and Christmas time celebrations. The battle goes on with about 30% of America's adult population still not vaccinated.
Our fate is in our own hands. It is absolutely essential that unvaccinated people get vaccinated and the vaccinated people get boosters.
Daily infections are now rising by at least 10% in 35 states. And now there's the threat of that new and potentially more transmissible variant, which many doctors believe is likely already in the U.S. Jennifer Johnson, Global News, Washington.
Just hours after the UK confirmed 2 cases of the Omicron variant, Prime Minister Boris Johnson implemented swift and sweeping measures.
We will also go further in asking all of you to help contain the spread of this variant by tightening up the rules on face coverings in shops and on public transport.
Little is known about the 2 cases, but the British Health Minister says they are linked. The UK is banning travel from a number of countries.
We are adding 4 more countries to the red list from 4 a.m. on Sunday, and those are Angola, Mozambique, Malawi, and Zambia.
That's in addition to the 6 other Southern Africa countries already on the red list.
The people are getting more and more upset.
Paula Zimmerman had returned to the Netherlands from South Africa, which is on the UK's list. She describes a chaotic scene with the plane being held on the tarmac for hours, long lines for COVID-19 testing, and then a shock.
I thought everybody who was in that queue there was tested negatively, but we were waiting there for the bus, and after 20 minutes, I heard that the guy next to me was tested positive.
Friday, Canada's top doctor said health officials continue to search for possible cases in this country, but so far none have been found in post-arrival screening of international travelers.
For the individual in Ontario and in Canada, there's no change. Get your vaccines when you're eligible, keep wearing your mask, keep adhering to public health measures, and we'll be okay. We actually will be.
The UK is doing all that, plus boosting the booster shot program. The World Health Organization has called for a moratorium on widespread booster programs until there is vaccine equity across the globe. So far, Canada isn't following Britain's lead. Our health minister said the health of Canadians has been the priority, while also helping others.
We have not only promised 200 million doses over the next year to countries that need their population to be vaccinated, but we've already started to deliver millions of doses to those countries.
Now, those deliveries are key, as health officials stress the pandemic won't be over in Canada until it's over everywhere across the globe. Michael Couteur, Global News, Ottawa.